And so after a century of talk, after decades of trying, after a year of sustained debate, we finally made health care reform a reality here in America. And despite the constant doom and gloom predictions, the unending chicken little warnings that somehow making health insurance fair and easier to buy would lead to the end of freedom, the end of the American way of life. Lo and behold, it did not happen. None of this came to pass. In fact, in a lot of ways, the Affordable Care Act worked out better than some of us anticipated. Nearly 1 in 3 uninsured Americans have already been covered, more than 16 million people, driving our uninsured rate to its lowest level ever. Ever. On top of that, tens of millions more enjoy new protections with the coverage that they've already got. That 85% who had health insurance, they may not know that they've got a better deal now than they did, but they do. Americans can no longer be denied coverage because of pre-existing conditions. From you having had cancer to you having had a baby. Women can't be charged more just for being a woman. And they get free preventive services like mammograms. And there are no more annual or lifetime caps on the care patients receive. Medicare has been strengthened and protected. We've added 13 years to its actuarial life. The financial difference for business owners trying to invest and grow and the families trying to save and spend, that's real too. Health care prices have risen at the lowest rate in 50 years. Employer premiums are rising at a rate tied for the lowest on record. The average family premium is $1,800 lower today than it would have been had trends over the decade before the ACA passed continued. In the years to come, countless Americans who can now buy plans that are portable and affordable on a competitive marketplace will be free to chase their own ideas, unleash new enterprises across the country, knowing they'll be able to buy health insurance. And here's the thing, that security won't just be there for us, it'll be there for our kids as they go through life. When they graduate from college, they're looking for that first job, they can stay on our plans until they're 26. When they start a family, pregnancy will no longer count against them as a pre-existing condition. When they change jobs or lose a job or strike out on their own to start a business, they'll still be able to get good coverage. They'll have that peace of mind all the way until they retire into a Medicare that now has cheaper prescription drugs and wellness visits to make sure that they stay healthy.